Namaskar, I'm Dr. Gagan Saini. I head the Radiation Oncology Department in Yashoda Medicity. I'm working as the Vice Chairman of the department. Radiation therapy works alone in many cases. This is especially relevant for cases which are small, the tumors which are small or early in stage. In such cases, radiation therapy alone can be curative. One thing we have to remember about radiation is that almost all the time our approach is curative when we are doing radiation therapy. A good example can be an early vocal cord cancer or an early mouth cancer or a throat cancer, many early skin cancers, lung cancers, liver lesions which are very small and early, or sometimes rectal cancers in carefully considered situations, prostate cancers, and bladder cancer. So these are situations where many more, but from the top of my head, these are the situations in which radiation therapy works alone and works to cure the patient. The advances in computer science that have come about in the last 2 decades, they have benefited radiation therapy a lot. It is in fact one branch of medicine which has probably maximally benefited from it. What has happened? So earlier we used to give radiation therapy by looking at patients' bony landmarks and focusing the radiation at some place, hoping and wishing for the best. But now, over the last 20 to 30 years, we have started focusing radiation based on not only patients' landmarks but patients' actual anatomy, using CT scans, MRIs, PET CT scans, and whatever else is relevant for the individual patient. Not just that, we've started calculating the radiation therapy better. Now, what does that mean? This is commonly called as IMRT, intensity modulated RT. We are using these computing powers to make sure that the radiation therapy going at the target is only going to the target and is falling off in the surrounding areas. That saves the surrounding structures. Then we moved ahead. We started doing image guidance because the radiation therapy now was so focused that if we are not, sure where the radiation is going, we can actually miss the target. So image-guided radiation therapy came in where we would use radiation therapy delivery with image guidance. But now we are going further ahead. Now we are going into intra-fraction radiation therapy monitoring. So intra-fraction, we monitor radiation therapy to the tumor. So we see the tumor during the course of radiation. This technology is called exact track or surface-guided radiotherapy. This technology helps us visualize the tumor or the relevant landmarks of the tumor during the radiation therapy being given. This helps us plan and deliver radiation therapy in a dynamic manner. We can actually modify our treatment mid-course if the things are not going well. Well, things are not stopping here. Things are going further ahead. Not only are we giving radiation therapy with image guidance and monitoring of the things are going further ahead. Not only are we giving radiation therapy with image guidance during the course of radiation therapy, we are able to do it with a pinpoint precision. This pinpoint precision helps me make the tumor disappear in smallest of the areas and some most difficult to reach areas. The most common example is brain tumor, but the other examples are liver cancers, lung cancers, bone lesions which are especially in vertebra. You cannot remove the vertebral lesions by surgery, but you can ablate it by radiation. So these are the advancements in radiation and they are all clinically very relevant. Radiation therapy can be avoided by select patients who are in very early stage and this treatment has been done properly by surgery with adequate margins. These are the patients that can be made to avoid radiation. We don't advise radiation to every patient. Also, some medical conditions like DNA repair disorders, which can lead to some poor healing of the surrounding structures. Otherwise, the healing happens very fast because the radiation is going very less in the surrounding structures. But in certain situations, the surrounding structures can get damaged more due to some DNA repair disorders like ataxia telangiectasia. And these are some very, very rare circumstances in which radiation therapy needs to be avoided. Well, the most common myth about radiation therapy is actually that radiation therapy burns the tumor. This is a very common myth and almost everybody, many doctors also believe that. That's probably because when the patient is getting radiation therapy, they get some skin burns and those sort of things. Well, radiation therapy does not burn. Radiation therapy is a biological treatment which deposits the radiation therapy dose to the DNA. So radiation, we know, is energy, and that energy, because of its frequency, because it is X-ray in nature, it goes straight to the DNA and it damages the DNA. Now what happens after that? Once the DNA gets damaged, it's unable to replicate the cancer cell further. And what happens due to that? The cancer cell can die in the next subsequent cell cycle. So it's not burning the cell. It is actually incapacitating the cell for the next cycle. This is the reason why radiation therapy comes to its maximum benefit after a month, 2 months, or 3 months, depending upon the cancer and the completion of radiation therapy. Most patients are told to not rub their skin, because whenever radiation therapy is entering any of the target, it is entering through the skin, because the whole body is covered with skin. And skin is a fast dividing organ. The cells, they divide very fast. So these are the cells which can get some extra damage due to radiation therapy, which is the reason why they look burnt when some patient is receiving radiation. So we tell them not to rub the skin and definitely not put hygroscopic things like soap. So this is a very important precaution, first and foremost. And then, of course, everything depends upon where the radiation is going on. For example, if it is a tumor close to throat, then we want them to avoid taking spicy foods. Or if the tumor is, say, close to certain organ or something, then we may want that organ to be saved by in a certain way, like during radiation therapy for breast, for left side where the heart is, we tell the patients to keep themselves fully breathed in, full inspiration, so that the heart can be further away from the breast and the radiation therapy can be avoided to the heart. So each tumor site, each type of radiation therapy is planned very specifically for each patient, and the side effects are according to that treatment, and therefore the precautions are also according to that.